welcome back. Now, February is American Heart Month, but it's also the peak of flu season.
And emergency room visits due to flu, RSV, and COVID all on the rise. To explain how to keep ourselves healthy when respiratory illness this season is in full swing, Dr. David Rzeszutko, Vice President of Medical and Clinical Operations at Priority Health. Dr. Rzeszutko, thanks so much for being with us.
Good morning, Bill. Thanks for having me.
All right, let's start with cold and flu season first. Yes. I'm talking about it a lot on our newscasts that cases are on the rise.
It's like everyone's affected by it at this point.
It's hard to avoid, really. What are you seeing in terms of just numbers? How does this compare to any other flu season?
Yeah, so the seasonal influenza activity definitely remains elevated all across the country, particularly in the Midwest. So Michigan and the Upper Peninsula area, Wisconsin, Illinois, Indiana, Ohio. Definitely cases are rising. We believe that we're hitting a peak just about now. And this is, to what you mentioned, one of the most severe years for influenza that we've seen in probably more than a decade.
Wow. Is it because of all three of them? The flu, I feel like we talk about it on the news all the time, the triple
whammy,
the flu, RSV, and COVID, with all of that being kind of in it, is it just peaking in the emergency rooms pretty much every day now?
Yeah, Kaylee, it really is. So you will read a little bit about the triple-demic, which is, the three separate viruses, or even the quad-demic, which includes norovirus, which is more of a gastroenterologic type virus that is endemic at this time of year. But our cases of influenza are on the rise and plateauing, whereas COVID is moderating, and RSV, that's the third in the triple-demic respiratory syncytial virus, that is also either plateaued or on the decline right now. So most of the cases that we're seeing are influenza.
Okay.
All right. So we're hearing that the number of ER visits is quadrupled in just the last 6 weeks, just to start off the year. Is it too late to get a flu shot? And if so, what other precautions can we be taking just to kind of stay as healthy as possible?
Yeah, so getting vaccinated is probably the single biggest thing that we can do to prevent the illness and prevent the spread. So vaccination is available for influenza for everybody age 6 months and up. Coronavirus or COVID-19 vaccine, similarly recommended, and it's definitely not too late to get either of those virus vaccinations. We typically are recommending, though, if you are going to be getting the vaccine, talk with your physician, because we really don't want you to be ill when you're actually getting the vaccine. That's why it's really recommended to vaccinate in advance of the season by a few weeks, 6 or 8 weeks if possible. But it's certainly not too late to get the vaccination. We'd recommend just talking with your clinicians.
And if you are sick, what's the fastest road to recovery? When do you know if you just kind of tough it out at home, or if you need to go in and see a doctor or urgent care?
Yeah, it's mostly supportive care. So, keeping yourself very well hydrated, getting plenty of rest. This year, the symptoms are really associated with a lot of fever and body aches, almost a lot of the myalgia and muscle aches, sore throat. Sometimes we're seeing a little bit of vomiting and diarrhea. And so keeping yourself hydrated to prevent dehydration is really, really important. If you are seeing a high spike in temperature that's unrelenting, or having difficulty actually breathing or air hunger, those would be warning signs to say maybe you want to go ahead and seek professional help other than just staying home. The other big way that we really want to prevent, the other big way that we really want to prevent and help the condition is to prevent the spread. And so if you are ill or feeling ill, we'd like you to, basically, maybe, stay home or limit your exposure to folks. Certainly, we talk about masking. If you are out and have to sneeze or cough, use your elbow, things like that. So we're not increasing the spread, because these are respiratory droplet spread.
Right. Now, February, we're always think about the flu, but it's also another important month. It's the American Heart Month. And when thinking about that, I don't know, I always think of maybe elderly's getting heart attacks or just heart health in general. It's when you're older. But what's some things that we should also keep in mind when we go into February with the American Heart Month?
Yeah, so Haley, as you mentioned, we are seeing an increased cardiovascular incidence, heart disease, heart attacks, stroke, or stroke, as well as high blood pressure in younger and younger folks. It's not just trending in the seniors or the over 65 population.
Right.
So we're definitely seeing more high blood pressure and again heart disease occurring in younger folks.
In just the last few seconds here, Doctor, just give us a good place to go for resources for
Yeah.
American Heart Month, and maybe if we have some concerns or if there's a family history, or even if we just want to stay on top of what we do need to know as maybe a younger person to keep that in mind.
Yeah, the American Heart Association has a lot of great resources online. So too does Priority Health. You can reach us at priorityhealth.com. There's a ton of information on our Think Health, which is information related to both heart health as well as any other major conditions that you may be suffering from.
Very good.
Awesome. Thank you so
Dr.
much.
David Rzeszutko from Priority Health, thanks for being with us. Good to have you on the show.
Thanks for having me. Have a great day.
Thank
Yeah,
you.
You as well.